Do you know the warning signs of diabetes, the silent predator that could be lurking in your body? Diabetes, a prevalent health issue worldwide, often creeps up unnoticed. It's crucial to recognize its warning signs early to prevent potential long-term complications. Understanding these signs is the first step towards a healthier, more informed life. Don't let this silent predator catch you off guard. Stay tuned as we delve into the telltale signs of this disease. First up on our list, an unquenchable thirst and frequent trips to the bathroom. So, what's the connection between diabetes and these symptoms? Well, when you have diabetes, your body struggles with processing sugar or glucose. This excess glucose ends up in your bloodstream, and your kidneys are forced to work overtime to filter and absorb it. But sometimes they just can't keep up. When this happens, the surplus glucose is expelled from your body through urine, and your body's natural response is to try and replenish those lost fluids, hence the increased thirst. Now imagine this cycle happening over and over again, day in and day out. You're constantly thirsty, so you're always drinking water. And because you're drinking so much, you're also using the bathroom more than usual. It's like a domino effect. If you're constantly filling up your water bottle or making frequent bathroom breaks, it might be time to see a doctor. Next, we look at what happens when your body can't get enough fuel. When you have diabetes, your body struggles to use glucose effectively. Glucose, a type of sugar, is the main source of energy for your body's cells. When this system malfunctions, your body starts to crave more fuel, leading to persistent hunger, regardless of how much you eat. But here's the paradox. Despite eating more than usual, you might notice unexplained weight loss. This happens because your body, unable to use glucose for energy, starts to burn fat and muscle instead. It's like your body is running a marathon without ever leaving the couch. This unusual combination of symptoms, persistent hunger and unexplained weight loss, can seem confusing, but they are just your body's way of telling you that it's not getting the energy it needs. So if you're eating like a horse but still losing weight, it might be time to speak to a healthcare professional. Remember, sudden weight loss or constant hunger could be a sign that something is not right. Ever feel like you just can't shake that tired feeling? It's not uncommon to feel fatigue after a long day or lack of sleep, but constant fatigue may be a sign of something more serious. When your body isn't effectively using glucose, your cells aren't getting the fuel they need. This lack of energy can leave you feeling persistently tired, no matter how much rest you get. But fatigue isn't the only symptom. Irritability often goes hand in hand with constant fatigue. When our cells are starved of glucose, our brain doesn't function as it should. We can become easily frustrated, short-tempered, or find it hard to concentrate. It's like trying to drive a car with no gas. It simply doesn't work well. These symptoms, while common in many conditions, could be an early warning sign of diabetes. So, if you're always tired and moody, don't just brush it off. It could be a sign of diabetes. Our fourth sign takes us to the eyes and skin. Now let's talk about how high blood sugar levels can impact them. When blood sugar levels rise and stay high for an extended period, it can cause damage to the small blood vessels in the eyes, leading to blurry vision. It's like trying to look through a fogged-up window. This is not permanent, and vision usually returns to normal once blood sugar levels are controlled. On the other hand, high blood sugar levels can also slow down the body's healing process. This means sores or cuts might take longer than usual to heal. This is because sustained high blood sugar levels can affect the blood flow, thereby reducing the body's ability to heal injuries efficiently. So, if you've noticed that your vision is often blurry, or you have sores that seem to take forever to heal, it's important to pay attention. Blurry vision or sores that won't heal? Don't ignore these signs. Last but not least, we look at what's happening at the tips of your fingers and toes. When it comes to diabetes, these extremities can often tell us a fascinating yet concerning story. Imagine your body as a city, and the nerves as its extensive network of roads. Diabetes, much like an unruly storm, can wreak havoc on this system, causing damage to these roads. This damage is known as neuropathy. Now, why does this matter to your hands and feet? Well, these areas are particularly vulnerable to this storm. When the nerves are damaged, they may send incorrect signals to your brain, or in some cases, stop sending signals altogether. This disruption often results in a feeling of numbness or a tingling sensation, like pins and needles. This isn't just about discomfort, though. These sensations can be early signs of nerve damage due to diabetes. So remember, numbness and tingling are not just discomforts, they could be warnings. Now that you know the signs, what's the next step? Well, it's time to talk about the critical role of early detection and regular checkups in managing your health. Just as a mechanic needs to inspect a car to diagnose any issues, Your body too needs regular checkups to ensure everything is running smoothly. Early detection is the key to managing many health conditions, and diabetes is no exception. The sooner you recognize the signs, the sooner you can take action. Now keep in mind, experiencing these symptoms doesn't automatically mean you have diabetes. But just like the check engine light in your car, there's signals your body is sending you that something might not be right. Ignoring them is like driving on with a blinking check engine light, hoping the problem will disappear. It might, but it's more likely that the problem will get worse. So, what should you do if you're experiencing any of these symptoms? The answer is simple: schedule an appointment with your doctor. They're the experts after all. They can run tests, ask questions, and get a complete picture of what's going on inside your body. Now, we understand that the idea of going to the doctor can be intimidating. The fear of the unknown, the potential for bad news, it can be scary. But remember, knowledge is power. Knowing what's going on with your body gives you the power to take charge of your health. If you do have diabetes, catching it early can make a world of difference. It can mean the difference between managing the condition effectively and facing serious complications down the line. It's like catching a small leak before it becomes a flood. And if you don't have diabetes, then you have the peace of mind of knowing that. You can then focus on maintaining your health and preventing any potential issues down the line. So let's recap. Early detection is key. If you're experiencing any of the symptoms we've talked about, don't ignore them. Schedule an appointment with your doctor. It's not just about knowing, it's about doing. It's about taking control of your health and making sure you're doing everything you can to stay healthy. Take charge of your health today. If you're experiencing any of these signs, schedule an appointment with your doctor. It's better to know than to live in the dark. Remember, early detection can make all the difference. Subscribe for more tips on matters health.